Pexastimogene devacirepvec. GM-594 is an oncolytic virus is designed to target and destroy cancer cells. It is also known as Pexavec, IN and Pexastimogene devacirepvec, and was constructed in Dr. Edmund Lattime's lab at Thomas Jefferson University, tested in clinical trials on melanoma patients, and licensed and further developed by ScyllaGen. GM-594 is a modified Copenhagen strain or Wyeth strain vaccinia poxvirus engineered by addition of the GM-CSF gene and deletion of the thymidine kinase gene, which limits VIR. Typically seen in cancer cells with a mutated RAS or 53 gene. The virus also has the LacZ gene insertion under control of the 7.5 promoter. The virus kills the infected/cancer cells by lysis and also expresses GM-CSF, which may help initiate an anti-tumor immune response. It has orphan drug designation from U.S. Food and Drug Administration and EUMA for the treatment of hepatocellular carcinoma liver cancer. In clinical trials, doses have been administered by intratumoral or intravenous injection. Technology. Pexavec GM-594 is the most advanced product candidate from ScyllaGen's proprietary Solve-Etim selective oncolytic vaccinia engineering platform. Solve is used to optimize virus targeting to specific cancer types, to select transgenes to include into the viral genome, and to optimize viral infection and/or replication selectively through targeted mutations. Oncolytic viruses could have three prolonged attack on cancer, direct cell lysis with replication and spread immune activation, and antivascular. Tumor-selective intratumoral replication of the virus leads to lysis of the infected cancer cell and spread to adjacent cancer cells, induction of tumor-specific cytotoxic T lymphocytes and arming for expression of therapeutic transgene products, e.g. GM-CSF enhance immune response to the tumor. Blood flow to tumors can be blocked following intratumoral replication and spread. GM-900 VVDD platform, next-gen enhanced oncolytic immunotherapy. GM-900 VVDD platform, next-gen enhanced oncolytic immunotherapy. GM-900 is a series of modified vaccinia vaccine Western Reserve strain with enhanced oncolytic potency, attenuation by a double deletion, thymidine kinase and vaccinia growth factor gene inactivation. GM-929 VVDD expressing CD4/5 pro-drug experience in solid tumors CRC and melanoma. GM-970 VVDD expressing granulocyte macrophage colony stimulating factor, next generation of the VVDD series. Clinical trials. A Phase 3 randomized, open-label clinical trial of Pexavec plus sorafenib versus sorafenib. The study is being done to determine and compare overall survival for patients in the two treatment arms. The study is sponsored by ScyllaGen, Inc. Mechanism of action of Pexavec GM-594. Study design. Participants will be randomly assigned to one of two treatment arms, having an equal chance of receiving either Pexavec followed by sorafenib or sorafenib alone. Arm A, Pexavec followed by sorafenib. Participants will visit the study center approximately 14 times over 18 weeks. All Pexavec treatments, 3 will be given by intratumoral injections into liver tumors. Following Pexavec injection series completion, patients will receive sorafenib starting at week 6 of the study. Arm B, sorafenib. Participants will visit the study center approximately 12 times over 18 weeks and receive sorafenib as per standard of care. Pipeline candidates. JX Next Generation. Novel oncolytic viruses in ScyllaGen pipeline are engineered through the selective oncolytic vaccinia engineering Solve platform. GM-929. GM-929 is derived from Western Reserve strain vaccinia virus. JX-929's tumor selectivity has been optimized through deletion of thymidine kinase and vaccinia growth factor. JX-929 has been administered as a monotherapy to patients with breast, colorectal, and pancreatic cancer via intratumoral and intravenous injections in a Phase 1 dose escalation clinical trial. This Phase 1 study showed delivery to and replication within tumors both IT and Roman 4. JX-970 JX-970 is also derived from a Western reserve strain vaccinia virus and utilizes the same tumor selectivity mechanisms as JX-929. In addition, it expresses granulocyte macrophage colony stimulating factor to stimulate immune responses. In non-clinical studies, the JX-970 backbone exerted a tumor debulking effect and at the same time demonstrated a selective preference for tumor tissues. The precursor of JX-970 is JX-963, which demonstrated efficacy in preclinical studies.